Good afternoon, ladies and gentlemen. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in listen-only mode. For those connected by telephone requiring operator assistance during the call, please press star 0. Web participants requiring support should use the chat feature on their screen. I would now like to turn the meeting over to your moderator, Linda Piazza, Senior Director at the Canadian Foundation for Healthcare Improvement. Please go ahead.
Hello and welcome to today's extra Cohort 15 informational webinar. I'm Linda Piazza, a Senior Director at the Canadian Foundation for Healthcare Improvement. I'm very pleased to be your host today. During this webinar, we'll be sharing information about the 2019-2020 Extra program. We'll be happy to answer any questions you may have. And we're pleased to have more than 70 participants from coast to coast with us today. So again, welcome. We are providing simultaneous interpretation for this webinar and invite you to participate in our chat box in either official language. If you would like to access the French presentation and audio, please let us know using the chat box as soon as possible. Now, as I introduce our speakers, please take a moment to introduce yourselves using the chat box on the screen. Let us know how many people are attending from your location, including yourself. Let's go to the next slide. We are very pleased today to have 3 extra fellows on our call. I'm the only one up there who's not an extra fellow. Carole Board is Assistant Director at CISSS Chaudière-Appalaches in Quebec. Carole participated in Cohort 13 of the Extra program with the team from that organization. And Carole is is, and always will be, our Cohort 13 NAMARC Award winner. Dallas Smith is Project Manager, Health System Improvement and Transformation with the Department of Health and Social Services in the Yukon government. Dallas is currently participating as an extra fellow in Cohort 14. He's with his team from the Government of Yukon and the Yukon Hospital Corporation. Finally, we have Patty O'Connor, who is our Curriculum and Faculty Coordinator. Patty is a registered nurse, holds a Master of Science in Nursing, is a certified health executive, and has completed fellowships with the Extra program, our very first cohort, which was 2004, the U.S. Commonwealth Fund's Harkness program, and the Canadian College of Health Leaders. Patty works as an independent consultant. She's also an assistant professor for the Ingram School of Nursing at McGill. Patty has over 40 years of experience in healthcare, including 13 at the executive level. As the former Chief Nursing Officer at the McGill University Health Center, Patty led innovations in partnering with patients and frontline staff to co-design improvements in care delivery that are now recognized as leading practices by Accreditation Canada. And I have in the studio with me in Ottawa our producers, Sheena Powell and Kelly Ripley, and from our extra team, Jessica Fournier, who will help moderate the chat. So our today's call will cover, we'll try to give you a good overview and then hear your questions on all elements. But we'll cover the basics. We'll hear firsthand from past and current fellow on the experience. We'll describe our approach for the Extra program and give you some detailed information about the application. I'll start by giving a brief overview of CFHI. You see up there our current strategic plan. We're just finalizing a new one, which actually looks a lot like this. We just refreshed it. I think we were on the right track, so we haven't changed it dramatically. But for those of you who are not familiar with CFHI, we are a not-for-profit healthcare improvement organization funded by Health Canada, dedicated to accelerating healthcare improvement by building leadership and skill capacity to champion and lead improvement, by enabling patient, family, and community engagement, meaningful engagement, and involving those who experience and need care as experts in making and co-designing improvements. Applying improvement tools and methods to drive measurable results towards better care, better health, and better value. And also creating collaborations to spread evidence-informed improvement across Canada to better the health of populations. One of the ways in which CFHI supports organizations to achieve the above is through the EXTRA program, Executive Training Program. So focusing on that program itself, which is really our flagship program, as I mentioned, it started in 2004, and we are now preparing for Cohort 15. This is a 14-month Pan-Canadian Quality Improvement and Leadership Fellowship. EXTRA supports teams of senior health leaders as they design, implement, and evaluate evidence-informed solutions in their organizations. We aim to enhance the capacity of leaders and teams, build the capacity of organizations, and create a pan-Canadian community of leaders dedicated to innovation, and to accelerate sustainable design, implementation, and evaluation of evidence-informed improvement projects that are critical to the strategic priorities of your organizations. So our approach is as I mentioned, it's your own project, whatever is important to you. Organizations select a quality improvement project, identify a team of 3 or 4 senior health leaders, and it is that core team of 3 or 4 that are known in the program as fellows. So working in teams and guided by expert CFHI faculty and coaches, fellows apply the knowledge and the skills they learn to design, implement, and evaluate breakthrough innovations or different approaches, and to create the conditions for their sustainability and spread. We have renowned Canadian and international faculty to deliver the EXTRA curriculum with support from CFHI coaches and staff. The curriculum is guided by CFHI's 6 levers for healthcare improvement, which we'll be hearing more about later. It's delivered through 4 in-person residency sessions, a series of interactive webinars, and an online platform. For Cohort 15, there is no special theme. Improvement projects should be driven by the priorities of your organization, and they should reflect the change that you want to make happen. We'll go into the cost a bit later, but the cost for participating is $5,000 per fellow. So EXTRA's impact has been proven over the years. More than 100 of the 411 fellows are now working at senior executive levels in organizations across Canada. Many improvement projects have resulted in meaningful improvement in the fellows' organizations, the region, and even spread across the country. A team within the University Health Network in Toronto, for example, reduced preventable emergency room visits by 57% at a long-term care facility. And if this initiative was implemented nationally, it would save our system $22.5 million annually. A team from Eastern Health in Newfoundland and Labrador reduced wait times for orthopedic services by 45%. Several of our EXTRA projects have gone on to become CFHI spread collaboratives, including the appropriate prescribing collaboration, which reduces inappropriate use of antipsychotics in long-term care. So as you can see, organizations and teams are producing real results. So I'm going to turn over now to Carol, who will let you know a little bit about the fellow experience. As I said, Carol is a Cohort 13 EXTRA graduate. And a note to our English-speaking audience, you will be hearing the voice of our translator. Carol will be speaking in French, and as such, you may hear a slight delay. Please go ahead, Carol.
Hello. So, thank you very much. Good afternoon, everyone, or good morning. My name is Carole Borde from 6 Chaudière-Appalaches. But for my Francophone colleagues, you will have noticed that I have a slight Mediterranean accent, but I've been in Quebec for 11 years, and over 7 years that I've been working in the health network, so I hope you can understand me in spite of my accent. So, my first question is how to prepare to submit a project, because I think that would be the first question you would ask yourselves. And I don't think the question should be, should I submit a project? Because I warmly recommend that you actually do. It's important to stress how much being part of the last extra cohort changed my professional life. So how would you prepare to submit a project? The starting point is having a problem related to your clientele, because we work in healthcare and we try to improve healthcare, in our case at Quebec-wide and even Canada-wide. So it's very important to have a problem, an issue that is related to our patients, the users of our services. The second prerequisite is support from senior management. We had our CEO as part of our team, and it was very, very important to have total support from senior management. That's how we were able to drive our project organizationally and to implement a new improvement culture as well in our organization. So I would say that those are the two key preconditions to prepare to submit your project. So select a problem that's very real in your organization, a problem that is known, a problem that is accepted by everyone to exist, and also get support from your senior management. Next, the team. I work in a more technical branch or support sector, if you like, because I'm assistant director of logistics. So I don't have clinical training, and therefore I was able to bring a different viewpoint to a very clinical problem. So collaboration from the various clinical sectors is key, and but it's not enough. You also need the support sectors. We had our CEO within our team. We had the director of research, and we had myself. So it was a very diverse team, and it was quite representative, actually, of the whole institution, the whole organization. And each of us had a different viewpoint that gave us a different take on the issue we were looking at. And I'll come back to that in a minute. So, do you need to speak English? Well, not necessarily. I don't speak English very well. I have a slight accent in English as I do in French, but the program is designed for fully bilingual participation. In fact, that was one of the key questions I asked at the beginning, namely whether speaking English was required, and I would say no, it's not. However, I did get some chances to improve my English, especially in the evening after 10 p.m. or so, talking to my colleagues from English-speaking provinces. What kind of time is required? Well, this is training, so you need to have a little time set aside to be able to accomplish the project. This also involves giving up some personal time, but when you're talking about the team, you have the extra team, of course, the specific team of fellows, but you also have a broader team because you rely on actually a much larger group of people within the organization, and of course they'll be giving you a hand to allow you to move forward in the project. So time isn't something that you have so much as something that you take, so it's up to you to see how much energy you want to devote. What allowed our team to succeed is that we split the tasks depending on our skills and our strengths, I would say, and that's what allowed us to invest time, but also there was trust to ensure that it wasn't always the same ones who were investing most of the time required. So these were a few tips about how to prepare to submit your project. So the patients have to be at the heart of your concerns, and you have to select an existing problem. You need support from senior management. A well put together team is key to success, and then being ready to invest time for the improvement of healthcare across your province and maybe across the country even, or at the very least across your organization, and as well as allow you to achieve growth through this training. So next slide, please. So I want to talk about our project that we carried out as a team. So the title, we had many different titles over the months, but the title we settled on was designed to really get the purpose of the program across. So the title we chose eventually is The Care Attendant for Patients Through Logistics. So we have a key problem in our long-term care homes in Quebec, and this is an increasing difficulty, that is to say, meet all of the residents' needs. Why? Because our clientele has increased needs. We have some evidence on that, but 80% have a profile of 10 to 14. So these are people who are heavily disabled and often have cognitive impairment. So we also have a severe shortage of human resources. We have local data, province-wide data. There's a severe shortage of personal care workers, especially. So we couldn't stay with the status quo, and so we thought maybe we could work differently to relieve our care teams. So our aim statement is to maintain or improve quality care for residents with cognitive impairments in our long-term care homes. We clearly had two parts in our aim. The first aim was to improve 10% face-to-face time between attendants and users. At first, we were working with two long-term care homes, and he decided to focus on one unit in one long-term care center. And I think we realized that even though we were ambitious at the beginning, it helps to start small and focus. And also we wanted to implement a new approach for attendants to relate to users. And our goals were to make sure that the right tasks were performed by the right people. We wanted to be able to clear time to reinvest in care time with residents, and one collateral benefit would be to reduce incidence of behavioral problems in residents. So it was a very complex problem. In the beginning, we had a lot of trouble defining the actual problem. We had to get lots of evidence, and we used the tools that CFHI placed at our disposal during our training. And if you are part of the next cohort, you'll see to what extent you have to invest work in that. The driver diagram. You'll be talking a lot about driver diagrams, but that diagram changed my life. I've taken training on Lean, on Six Sigma, and it really changed my paradigms to get another way to address quality improvement. I don't say any more, but you'll see this is one. This will be one crucial part of your training. So coming back to our project, we had to meet. We met a number of challenges, many of which we anticipated. If you want to work better with support teams, we have to break out of silos, and in terms of care time with residents, we have to make sure that the time is really reinvested with residents, because traditionally the nurse would delegate the tasks to the attendant, and the attendant performs a number of various tasks, not necessarily in care time, although care attendants are supposed to be trained to spend time caring for the residents. And we achieved pretty surprising success. We were hoping for success, but it went beyond our expectations in terms of our care unit at the Montmagny long-term care home, and we even managed to transform the entire care home and not just the one unit we started with, and we were able to reinvest 30 minutes minimum for each care attendant per shift, which is a lot of minutes that have been invested directly working with users, with residents, because we gave care attendants a toolkit of directed activities. They weren't given 30 minutes a day to just empty laundry bags or refill the care supplies. They used those 30 minutes working with residents to do activities, and there's really a significant gain in resident satisfaction. So the highlight of our project, and that's the most important thing for residents, is lunch. Lunch in the long-term care home is the most important time of day, and rather than running around performing tasks to set the table, clear the table, we would forget that the meal was a very important moment for residents. And working as a team, we were able to focus on the essence of our job, which is to care for our residents, especially that vulnerable clientele. So beyond the fact that we have excellent results in terms of timing for logistics and increased care time, the key is that our residents are now smiling again, for many of them, or most of them, because now they really have time to have lunch with attendants who are present in the moment. So that's for our project. I could talk about it for a long time, but I think that's not the point today. I just wanted to give you a flavor of what the scope was. Right now, we've completed the work on the Montmagny long-term care home. Now we're in the next phase. We've already chosen a second long-term care home, and we want to go into a spread phase, especially at the provincial scale, because we've got lots of other long-term care homes that have the same issues as Chaudière-Appalaches, and we know that we can spread the project province-wide, and why not Canada-wide. If we can go to the next slide. So our experience in the project, and I discovered that even more, we always rely on user contribution, partnership with patients, co-design. We talk about it a lot, but with Extra we had to actually do it, because it's one of the very important parts. It's a pillar of the training you'll be experiencing. It's co-designing the project with the user, and it was a revelation to me, because I only see the residents add or remove, but when we did the project, I came much closer to the residents than I had before, in order to understand their daily lives, to adapt our project, and that has a very powerful impact to be working with residents. So our patient partner was part of our Extra team. She was the one who co-designed the project with us. So we had an initial idea that was fairly similar to the way it actually eventually turned out. But after 2 meetings with our patient partner, and she was really a partner within our team, after a couple of sessions, we really refocused our vision, because we'd focused on work organization rather than residents' needs. So that was an incredible opportunity for us to bring our project forward together with our patient partner. And in fact, in the Extra training, the presence of residents, patients, users during the sessions is really a key part of moving forward with the project. So why do Extra? Well, first of all, the quality of education. We have faculty and coaches from around the world, very, very high quality resources. We had people from England, we had people from other Canadian provinces. It was unbelievable what we we're able to get out of these sessions, the expertise and the experience, then the tools, we were talking about the 6 levers earlier, so CFHI has amazing tools that can be used in daily life and that can really help change the organizational culture. This is important for us to achieve quality improvement in a different way. Leadership. This project, this training, reinforces the leadership that we may already have in organizations, but it supports us even more working as a team that works together for months and works together, and that really reinforces our organizational leadership. And the network also, because you create a network that way. Now we have a pan-Canadian network. We can exchange best practices and maybe things not to do, and we realize that people in Alberta, BC, Quebec, it's really the same issues that we experience, even though regulations may be different, but the residents have the same problems everywhere. So it's good to be able to share and to stay connected later, because it's essentially a family, the extra family that you join when you join the program. So to conclude, I just want to come back to the patient. The patient is at the heart of our decisions. The patient always has been at the heart of our decisions, but it's important to keep the patient at the heart of our project, co-design, not just write it in our procedures and our accreditation standards, but actually experience that, live that day to day. Honestly, I was skeptical that it could have such a significant impact at the outset, but if there's just one thing that I took from Extra, is that our patient partner was a key element in our project. And so why do it? And if you look at this little photo, that's our team, the 4 of us on Lake Louise in the middle of February, and that too, discovering other parts of Canada. It's refreshing, it's great, and especially with our kind of workload right now. So thank you very much. That was my little presentation.
Thank you so much, Carol. And now we'll hear from Dallas Smith, who is a current fellow in Cohort 14. Please go ahead, Dallas.
Okay. Thank you very much, Linda, and I'm quite excited to be able to speak about my experience today. I also want to thank Carol. I was very happy to hear that we've had some very similar information and similar experiences and perspectives on this exciting journey that some of you may be on. So today I kind of tried to break up what I'm going to speak about into 3 categories. So I was going to talk about the application and ultimately the change that will happen as a result of that. I am going to talk about the learnings and networking opportunities that I've experienced so far. And then I wanted to wrap up with why I think it's worth it and what I've gained from it. So when looking at the application, my advice, I guess, would be to really think about a project that matters and is important to your organization and system. Because I think when you identify something that is truly important, there's going to be that inherent motivation and support to keep moving forward with it. Because there will be times when it's frustrating and you're kind of confused as to why you're focusing on this project, and being able to come back to something that is really important to your organization will be helpful during those times. The other piece would be to spend some time between now and when the application is due to really define what your problem is and what you're trying to solve, and really trying to understand why it's a problem. And I think this is where our team in the Yukon found some challenges, because when we made the application, we originally had a plan to co-design a treatment planning tool with our patient partners so that they can transition back into the community. But through the process and through some challenging learning experiences with our patient partners, we actually had to change our whole project midway, or not midway through, but early on in the process. to really looking at developing UConn's own framework and tools that's going to allow our providers to really connect with people with lived experience so that we can start to co-design effectively together in very meaningful ways. So that would be my other tip for the application is think about it, but also expect that it's going to change. Once you start this project, you learn different ways to view your problem, different ways to understand solutions, and if you're picking something and really set that this is what we have to do, you might be challenged to try to think differently about what you're trying to do. And I think that was one of the most valuable experiences that our team had during this process. A little bit about the team is be prepared to put the time in to work with your team. And I think there's something in the description about Extra that you should be expecting to spend about a day a week. That's about accurate. Our team meets an hour and a half every week to talk about the project and to keep the project moving forward. And then we have our individual work on the side of that that's related to the project. There are 3 to 4 fellows that are part of the project, but also identify who else is going to be on that project team that may not be an extra fellow, but that's going to help the team implement the actions that you're creating. So spending some time beforehand to identify who's there to support the team, where's that leadership support, and who's your evaluation person, who's your project manager, things like that. So I'm going to shift now to sort of the lessons that I learned and the networking opportunities that have come through this experience. And so far, similar to what Carol had said, I don't think there's anything radically new, but it's having that focused time to think about concepts, theories, tools, and then applying them to real-life problems and real-life solutions. I think that's been one of the most valuable parts. The second piece is really the coaching and the faculty. So each team is assigned a coach, and that coach has been extremely valuable in terms of being able to bounce ideas around, talk about some of the challenges of the project, and really somebody who's not your supervisor or somebody that you're directly reporting to. So I feel like there's a lot more freedom to really talk about what needs to happen for the project instead of getting the project done, if people know what that means. The other big lessons that we've taken is there's a project, but it's part of a bigger system. And so it's thinking a little bit more long-term, thinking ahead, but still being able to scale it back into something that's doable and attainable in the time frame. Similar to, I guess, why we changed our problem, but developing different types of critical thinking skills to really understand and define a problem and a solution. And I think this has been the part that so far I've been able to apply to other parts of my job. So I oversee a lot of improvement initiatives within the Yukon government, and the skills and the theory that we've done in the Extra program has allowed me to be a little bit more constructive or critical or supportive of other teams in terms of the projects that they're doing. So I've already started to translate some of the knowledge and the way I think about problems and solutions and apply it to other projects that are going on in the Yukon. And then the last would be confidence. So it's taking these skills and things that I may have read about or learned about in school or have applied in various past positions, but really having the time to refine my skills, to become comfortable and confident in the application of those skills. And then the networking. Like as Carol said, you go through this experience with teams from across Canada. You get to spend time with them. You learn about what their challenges are, what they've done to try to address some challenges and some problems. You learn that there's a lot of similarities. There's a lot of learning that you do from hearing what others have done. And then, at least for maybe a specific thing that in the Yukon has happened, because we are a partnership between the Yukon government and our Yukon Hospital Corporation, the bringing of the two organizations together on a specific project has been huge in terms of learning about each other, building trust and connections with the teams from the organization that I'm not a part of, and working together has been so valuable at creating a much more cohesive system approach. So to wrap up, I want to talk a little bit about why I think it's worth it. So one, the faculty are incredible. They're amazing. They have a lot of different experiences that they bring and they share. And then you take that back to your jobs and you work with your coaches, you work with the other fellows on the team, and just that networking, that conversation, I think, has been extremely helpful. The other thing is when you identify this project, it is an 18-month time frame, and at least for myself, there's so many competing challenges and priorities that my job, we sometimes start something and then it gets sidetracked and then we delay it and then we come back to it at a later point in time. But when the project is part of Extra, there's a pre-commitment that we're going to make time every week. We're going to continue with this even when it gets challenging and hard and sometimes frustrating or setbacks. We still keep coming back to it. So it's a great way to prioritize a very important project that does need to happen and continue to focus on that and to continue to get support from not just within your organization but from across the country and through your coaches around how to keep moving that really important initiative forward. Third, I guess, would be the theory and the tools and the knowledge that you gain from those other participants in Extra and how you can apply it to your local context. I really like the academic side, so they bring a lot of theory and examples from all across the world, and I love to learn, so learning was a really great benefit for me. But I think the final thing that I'm going to wrap up here with is you meet some very cool people from different parts of the country facing similar challenges, and it's great to learn about their experiences, learn about yourself through that process, and learn and grow closer to the people that you already work with. So that Extra team becomes kind of like this little family unit, and you kind of learn and understand them in a different way, and that is really helpful in other work moving forward that needs to happen. So I think I'm going to wrap it up there, and thanks again for hearing my experience.
Dallas, thank you very much. And Patty, over to you now. Patty is our Curriculum and Faculty Coordinator, as I said, and she will give you some further information on curriculum, faculty, and coaching support. Over to you, Patty.
Thanks very much, Linda, and thank you so much, Carol and Dallas, for sharing what your experiences have been with the Extra program to date. Okay, so Extra is the Foundation's most intensive quality improvement program. It is designed for senior leaders within the organization, and upon completion of the program, fellows are well-versed in quality improvement methods and tools and know how to apply it in the design, implementation, and evaluation of improvement. While fellows are responsible for leading a major change initiative as part of the requirements of the program, the curriculum also focuses more broadly on what it takes to successfully lead complex organizations. Through case studies and sessions with expert faculty, as you've heard Dallas just mention, fellows have the opportunity to systematically examine key system delivery and policy issues in Canada, the UK, the US, and elsewhere. Extra is underpinned by CFHI's 6 levers for accelerating healthcare improvement. Based on their study of high-performing healthcare systems, Drs. Ross Baker and Jean-Louis Denis identified these 6 levers as critical to operational success. They include promoting evidence-informed decision-making, engaging frontline managers and providers in creating an improvement culture, engaging patients, families, and caregivers as partners in care and service design, focusing on population needs, creating supportive policies and incentives, and systematically building organizational capacity for quality improvement and leadership. In addition, the Extra program uses a number of other frameworks to guide fellows' learning. These include the IHI's Triple Aim, the National Health Service, the UK's change model and their sustainability model, the highly adoptable improvement model, which was developed by Chris Hayes, one of our faculty members, and the LEADS framework. The program is comprised of 4 learning modules over a 14-month period. The first module focuses on building organizational and team readiness and designing the improvement project. You get a lot of input during that 2.5 days of workshop on what's the beginning of your aim statements and what you think you want to be doing and the logic and rationale behind that. The second module, which occurs in August, is focused on enhancing leadership competencies and on refining the improvement project plan. The third module is focused on accelerating progress and implementing the improvement project. And the fourth module focuses on sustaining and spread and sharing the results. This timeline shows the progression of the 4 modules that focus on a balance of theory, improvement science, case studies, and tools and methods to spread successful change. The curriculum includes 4 multi-day in-person workshops in different locations within Canada, a series of interactive webinars across the 14 months, monthly coaching calls with your assigned coach, and an online learning platform for the fellows. Module 1 runs from late April through mid-August. Module 2 takes place during a 5-day workshop in August. Module 3 which focuses on the implementation phase, then runs from September through February. And Module 4 runs from mid-February until June, when teams report on the results and key lessons learned. And in August, the final written report is submitted. Extra's Advisory Council provides high-level strategic advice on program modification, directions, and partnership development. As well, they advise CFHI on the selection of the incoming teams based on the review of the applications that have been submitted. The Advisory Council includes 10 distinguished health leaders from across Canada, who include, from the top left box, Terry Sullivan, a consultant and professor in health policy at University of Toronto, Jean-Louis Denis, Professor of Health Policy and Management at the School of Public Health, University of Montreal, and Jean-Louis is faculty lead for Module 4. Christina Krause, CEO of BC's, British Columbia's Patient Safety and Quality Council. The second row, from left, is Martine Couture, former CEO of the CIUS Saguenay-Lac-Saint-Jean region. Chris Hayes, Chief Medical Officer, now at Trillium Health Partners. Sarah Downey, CEO, Michael Garron Hospital. And by the way, Chris is the faculty lead for Module 1. And the third row is myself as the curriculum and faculty coordinator and the leader of Module 2, and Armand Boudreau, who is a management consultant and chair of the coaching network for the Extra program. And Armand is also the lead faculty for Module 3. CFHI faculty members are renowned Canadian and international experts and organizational leaders who have extensive experience leading healthcare improvement initiatives. These faculty members advise CFHI on program design and curriculum development. They help deliver the curriculum throughout the program and identify guest presenters as appropriate. They identify opportunities for shared learning between organizations, provide advice and guidance to improvement teams, are available for consultation during each of the module sessions. At the end of each day of the formal sessions or consultation sessions that occur for about an hour and a half at the end of each day, where you can, just with your team alone and that consultant, can really drill down and have an important dialogue around some of the niggling issues that you're facing at that point in the program. The faculty also consult with CFHI through faculty and coaching meetings, and they champion CFHI's programs in other organizations and regions. And lastly are our coaching team. Each of the teams that's accepted in the program has a dedicated coach who supports the team throughout their program. CFHI coaches are senior health system leaders selected for their knowledge and experience leading health systems and improvement initiatives. The coaches understand the regions in which the teams are located and the complexity of leading change in dynamic organizations. They help the teams anticipate and navigate challenges, provide insights regarding strategies to gain momentum and support for their improvement project. And they also conduct in-person site visits. This year we moved it, and those visits were occurring in late August and in September and early October. And they come and meet with your team, the teams that's selected, along with the CEO and the senior management team. And the coaches also have monthly calls with the teams by video or teleconference. And as I mentioned, they hold office hours during in-person workshop sessions. And now back to you, Linda.
Thank you so much, Patty. That was a great overview. And thanks to Carol and Dallas as well. I'll now share a little bit more information about the extra application process. I'll try and move along a bit here to leave room for your questions. And I would encourage you now to start putting in those questions or comments for Carol, Dallas, or Patty using the chat box on your screen, and we'll address them shortly. So if you're thinking, you have a lot more information now from our speakers. But if you are thinking of joining Extra, keep in mind that this is for your organization. If you are interested in building improvement capacity, Extra builds capacity at 3 levels: individual leadership skills, improvement capacity at organization level, and also building partnerships across regions and sectors, and networking that goes on long past the 14 months. Teams can be from a single organization. They can be from several organizations who want to work collaboratively. A team is comprised of 3 fellows, 3 to 4 fellows. That's the core team, and as I think Dallas mentioned, there is, of course, an extended team that you'll be drawing into your project, but that is the core team that participates in the residencies and the program. Organizations outside of Canada are welcome to apply. I have here some examples of the type of organizations that would apply. Any healthcare delivery organization, including health authorities, hospitals, rehabilitation centers, long-term care, primary care practices, public health organizations, ministries of health, community, charity, not-for-profit organizations, social service organizations, for example, children and youth, housing, etc., and Indigenous health organizations, and others. I think we all know that health goes way beyond the healthcare sector, so we do leave that pretty open for the type of organization that we welcome. And then, so roles, responsibilities, and resources. The fellows, the 3 to 4 fellows per team, should be at a career stage where they have a significant scope of authority, have the influence, the responsibility, and the authority to actually implement the project. Examples of of the titles of people that are often on the teams include Vice President, Chief Operating Officer, Chief Nursing Officer, Directors, Department Heads, Chiefs, Chief of Medicine, Patient or Family Advisor. We would welcome having Patient or Family Advisor actually on the core team. From the Ministries of Health, Assistant Deputy Minister, Director General, Executive Director, and managers in leadership positions. All teams, as you've heard from I think both of our recent fellows, need access to strategic advice and guidance from key leaders. This includes a minimum of 2 patient advisors on the steering committee. They can include as a member of the team, or they must appropriately engage clinicians, providers, patients, and family. And all teams need access to performance measurement and evaluation and project management support. So if we look at the responsibilities for CEO and senior leadership, this is one of the key ingredients for success. The senior leadership and CEO, whoever is the senior person at the organization, needs to be firmly behind the extra team and project in order to provide strategic advice and guidance related to leadership and change management. We do ask that they actively participate in the CFHI organizational capacity assessment, the site visits, reporting webinars, and they often and usually attend the final presentation. The senior leadership ensures that fellows have protected time to work. You've heard how important that is, and the resources required to successfully lead the improvement project. So full support of senior leadership is key to success. And as we've mentioned, improvement projects are focused on real-life health system solutions. We accept projects along any of the quality care dimensions, including patient and family-centered care, patient partnerships in care, coordination of care and care transitions, efficiency, accessibility, effective and appropriate care, safety, equity, population health, and health outcomes. Very importantly, the project should align with your organization's strategic priorities, your goals and plans, and the team members' responsibilities. A typical improvement project may address the needs of a target population, design a new product, process, or service, improve an existing process or service, spread a promising practice, or develop a framework or an infrastructure for improved governance, management, or quality. So if after this informational call you are interested in applying to the extra program, and we hope you all are, I can't stress how important this opportunity is, the extra coaching calls. We strongly encourage you to take advantage and have a 30-minute call with an experienced CFHI coach prior to submitting your application. The coaches can give you help and support as you put together your application, and provide with guidance on scoping and framing the improvement project, assembling the right teams, and other key elements. There's no fee associated with this call. To request a pre-application call, email us at the email provided at the bottom of the screen. The applications are due by February 12th at before 9 p.m. Eastern Time. To request an application, we ask that you email us at the email provided on the screen. It is not the application is not online. We do like to hear from you, and we will connect you with the application at that time. We have merit review. We have a staff screen at the beginning to screen applications for eligibility. The extra advisory committee convenes to review applications, and we will notify all applicants of the outcomes. A detailed description of the selection criteria used by reviewers is available in the call for applications which you will receive when you contact us for the application. So a little bit more about program fees and cost sharing. The cost of the extra program is significantly subsidized by CFHI as part of our commitment to working together to make change happen. We cover the costs including travel, accommodation, and two meals per day at 4 in-person workshops. Additionally, fellows have access to CFHI faculty, coaches, and the online learning platform known as the CFHI Desktop. Successful applicants contribute a one-time fee of $5,000 per fellow. A minimum of 3 and maximum of 4 fellows are required to participate. And we also encourage cost sharing. Organizations are encouraged to work together to share the costs of the extra program. For example, a large teaching hospital might partner with a smaller organization and develop a cost-sharing arrangement that mitigates the cost of participating for the smaller organization. And please contact us if you have any questions as you try and come up with cost-sharing methodologies. So up here are the key dates and milestones. I won't go over them all, but just to repeat that the deadline for applications is February 12th, 2018. You can look at those other dates at your leisure. I would like to move now to questions and discussion. We have an opportunity to take any questions you may have. Please share your questions using the chat box at the bottom right of your screen in either language. Do we have any questions? Out as they come in, and we'll see who wants to answer them. So here's one. The first question then is, has anything changed about the program and or the process from the last 2 cohorts' feedback? Well, I guess I could answer that one. Where is it? Oh, there. Patty's already onto it. Do you want me to read out the answer? Okay, so Patty's answer is, great question. The answer is yes. CFHI conducts extensive evaluations of every session, speaker, webinar with the extra fellows. We have used their feedback to modify or drop some sessions and to expand other content they find extremely useful. 3 years ago, there was no face-to-face workshop in Module 1, for example, and when fellows said they wanted contact with fellows earlier, we created a new Module 1 face-to-face workshop. So yes, we are continuously improving the program. So, has this been translated or what? This is the... Got that, yeah, I saw the answer to that before. Yeah, so we do have, is it possible to get access to the projects from previous participants? And all of our projects are up on the website. If you go to the CFHI website under What We Do, Extra Improvement Projects, you'll see all of the cohorts, all of the projects up there. Another question, great presentation, sorry to get on a few minutes late. Is the presentation recorded and available? Yes, it is recorded, and to access that on the website, you'll be able to find it on the website. We have another answer from Patty. Patty's way ahead of me on the questions. There are 3 to 4, I'm reading these out for Dallas because he can't see the, the box, but there are 3 to 4 fellows in the team? Is there a limit to the amount of people involved in the improvement project? And the answer to that is no. There is a limit to the core team members, but depending on the project, you will want to bring into your extended team whoever is necessary, and we help you work through that, do a stakeholder analysis, and work through who needs to be on your extended team. Well, there is. We usually accept about 10 teams. So if we had 11 or 12, we would probably try and find a way to take those teams. But yes, we do limit it to not much more than 10 teams of 3 to 4 core members. And Patty has added to the comment about the size of teams. Each team usually has a larger overall team, and it is important to establish your steering committee with key stakeholders. And that is true. And that includes 2 patient advisors. We do ask that 2 patient advisors be on your steering committee. So we are now out of time. If you have further questions, please follow up with an email. I'd like to thank our speakers for their excellent presentations today, and to you, our audience, for your participation. We hope that the session has been helpful in explaining the nature of the EXTRA program, and that the discussion will spark a dialogue within your organization about healthcare improvement, and especially about submitting an application to EXTRA. So we're going to launch live polling here now. Your feedback is appreciated. Please let us know if you're interested in submitting an application for the EXTRA program. If you're interested in setting up a coaching call to learn more about the application process and requirements. We can contact you to further discuss any aspect of the EXTRA program and to answer any other questions for you that will help your organization decide if EXTRA is a good fit. Once again, I would like to thank Carol Board, Dallas Smith, and Patty O'Connor for their excellent presentations today. Thank you to Kelly and Sheena for the work you do behind the scenes, and thank you to Jessica for helping to moderate the chat. And thanks to you, most of all, our audience, for joining us today. This concludes today's webinar. Have a great day. Bye-bye.